Hello, great nurses. Welcome to your Career Pathway channel. Here we guide nurses on their pathway to success. Here is your career coach. In NUS 111 Applied Chemistry, Module 6, we discussed the classification of structures of organic and inorganic compounds and their impact on nursing science. Here in Module 7, we understand atomic structures and nuclear energy. Take note of this. Nuclear chemistry is not about atoms splitting. It's about knowing why you flush the toilet 3 times after an iodine 131 scan. That's how you keep patients and yourself alive. As we all know, the circles to success are as follows. Red circles indicate that these areas are a must-know for your next examination. Orange circles indicate that these areas are good for clinicals. Green circles indicate that there is need to skim through this video at later times. As we begin, we'll look into the specific objectives for Module 7. So we'll be discussing the following. 1. Discuss natural and artificial radioactivity. 2. List radioactive elements. 3. Discuss the types of radiations from radioactive elements such as alpha, beta, and gamma. 4. We explain nuclear structure and radioactive decay. 5. We explain the following: radioisotopes, nuclear reaction, nuclear energy, example, nuclear fusion and nuclear fission. We identify health hazards from radioactive substances. 7. We state precautionary measures taken against biochemical and radioactive substances used in the healthcare system. Let's begin with Objective 1. We want to discuss natural and artificial radioactivity. This will help us to determine exposure risks in diagnostics, in treatment, and environmental hazards. Natural and artificial radioactivity. Natural radioactivity occurs naturally without human intervention. This is found in elements such as uranium-238, radium-226, and thorium-232. So, uranium-238 is an isotope of uranium. This is an isotope of radium. Thorium-232 is an isotope of thorium. Sources of natural radioactivities are soil, rocks, cosmic rays, and some food that we eat. Food such as banana, due to potassium 40. The banana we eat has a small amount of potassium 40. It is not really dangerous to the human health. Example, in the decay of uranium to lead over billions of years, uranium can decay, forming lead over billions of years. Artificial radioactivity, they are induced by humans through nuclear reactions. Nuclear reactions, for example, in reactors and in cyclotrons. Production of technetium-99m is an example of an artificial radioactivity. It is commonly used in the medical field for imaging studies. It is also used for diagnostic imaging such as cancer therapy, sterilization of medical equipment. How is natural and artificial radioactivity relevant to the nurse? It's relevant to the nurse in understanding natural exposure, which helps nurses to explain background radiation to patients. 2. It is relevant to the nurse in the sense that artificial radioisotopes are part of diagnostic and therapeutic procedures which nurses often assist with. So there is need for the nurse to be informed. As a form of summary of what we have discussed so far, I want to look at the types, the nursing example, and critical nursing actions that nurses must take note of. To discuss natural radioactivity and artificial radioactivity, we look at their examples and critical nursing actions. Natural radioactivity example is radon gas, which is found in most hospital basements, and also potassium 40, which is found in the banana that we eat. Okay. Critical nursing action. Radon test basements must be done annually. Okay, for radon, you must understand that radon is a naturally occurring radioactive gas that is formed when uranium in the soil breaks down and rocks also break down. Radon can seep into homes, especially through basement of the ground. It can seep into the hospital area through the basement of the hospital and into the water that is being used in the hospital. So, chronic radon exposure can increase the risk of lung cancer. This is why it's important. It is actually the second leading cause of cancer after smoking. Therefore, it is important to test the basement annually using inexpensive radon kits. This is a preventive system measure, especially in areas where there are high naturally occurring uranium contacts. Also, for potassium 40, bananas are harmless. It contains about 0.1 microsoviet dose. So it is basically 1% of daily per gram, so it's not necessarily harmful for human body. The next one is artificial radioactivity. It is found in technetium-99m used in nuclear medicine scan. Also, cobalt-60 is also used in cancer radiotherapy. These are all artificial radioactivity types. Nursing critical action. After use of technetium-99m scan, there is need to limit contact with pregnant patients and children for 24 hours. Those who use radiotherapy must use shielding protocols. So as a nurse, if you are engaged in this, ensure that in the ward you are with your shielding protocols. For every staff in that ward, they must use shielding protocols. Take note of this. Natural radioactivity is not safe. Radon causes 21,000 US lung cancer deaths per year. This is researchable according to the EPA. What should the nurses do? Report musty basement odors in clinics. And you are in the clinic and you perceive musty basement odors. These must be reported. This is a typical sign of a cancer risk. Objective number 2. We want to discuss some radioactive elements nurses must know. So there are some radioactive elements that nurses must know. What are radioactive elements? Radioactive elements are elements that emit radiation as they decay to become stable. Example: uranium, radium, thorium, polonium, iodine 131, cesium 137. They are found in nature, they are used in medicine, they are used in the industry, and they are used in the research areas. Nurses must be aware. Nurses must be aware of radioactive materials used in the hospital. Example: iodine 131 is used for thyroid treatment. So these are some roundup of elements that nurses must know, especially their half-life. So we'll discuss half-life later, but half-life is simply defined as the time taken for a particular radioactive element to decay half of its original size. As radioactive elements decay, they become very stable. So we want to first look at number 1, iodine. Iodine is used in the hospital for treating thyroid cancer and the other diagnoses. Half-life of iodine 131 is 8 days. So it takes 8 days for iodine 131 to reduce its usual or previous amount or size. Nursing hazard. Thyroid uptake can lead to radiation burns. So nurses must be aware. Action: isolate patients. Flush the toilet 3 times after use. Patients who have been exposed to iodine 131, after they use the toilet, encourage them to flush 3 times. This is in order to prevent the risk of contact to other patients. Number 2, technetium 99m. How is it used in nursing? It is used in bone and heart scan, most commonly in diagnostics. The half-life of technetium 99m is 6 hours. Hazard for nurses. There is risk for contamination, especially when it spills and touches the human body. So there is need for nurses to wear dosimeter badges. Also learn to use lead syringe shield. There are syringe shields that will prevent spilling. They are specially used in the scan areas, so they must be available. So as to continue with the radioactive element that every nurse must know, we want to discuss cobalt-60. It is used in the sterilization of surgical tools. It has a half-life of 5.3 years. So nurses must understand that overexposure to cobalt-60 can lead to radiation risk and radiation sickness. So never enter the radiotherapy room during a beam on. Don't enter when the cobalt-60 beam is on. Next is radon 222. Radon 222 is a natural occurring gas that is usually found in most hospital basements. It has a half-life of 3.8 days. It can usually cause lung cancer. So exposure to radon will cause lung cancer risk. There is need to install radon detectors. There are detectors that can be installed and sound an alarm if they detect radon 222. There is also need to ventilate enclosed spaces. Enclosed spaces can lead exposure to radon. Next is uranium 238. Uranium 238 is found in depleted uranium. Usually some military armors can cause shrapnel wounds. Basically, nurses who are in the military must take note of this. It has a half-life of 4.5 billion years. Uranium 238 can cause heavy metal toxicity and radiation. There is need to treat as chemical hazard first. This could involve chelation therapy. Let's move to objective 3, types of radiation from radioactive elements. This will help us to dictate PPE choices and the contamination steps, and including patient isolations. Types of radiations from radioactive elements. As we can see, there are different types of radioactive elements, and we will be looking at their characteristics, we'll be looking at their features. So let's begin with alpha. Alpha particles have the following features. They are heavy, positively charged particles having 2 protons and 2 neutrons. Example is helium. It has low penetration and can be stopped by paper or skin. 3. It is dangerous only if ingested or inhaled. Let's go to beta particles. Beta particles are high-speed electron or positrons. They have moderate penetration. They are stopped by plastic or aluminum. They can damage tissues if not shielded properly. Gamma rays. Gamma radiation have high energy electronegative waves. They are very penetrating. They need lead or thick concrete for shielding. It is used in medical imaging and cancer radiotherapy. How are the types of radiation relevant to the nurse? Nurses working with gamma sources, example in the radiotherapy ward, must use lead aprons and maintain distance. The Alara principle tells the nurse that distance must be considered when dealing with radioactive elements. As a form of summary of what we have discussed about the types of radiation, let's look at some radiation types: penetration power, shielding needed, nursing example, and nursing action. For alpha particles, they are stopped by paper or skin. Shielding needed, you need shields such as your gown and your gloves when dealing with alpha particles. Nursing example, polonium-210 is an example, although it causes rare poisoning, because we have said that alpha particles are not too penetrating. Action: nurses must wash skin with soap and water and ensure that there is no internal exposure. Beta particles is number 2. They are stopped by plastic or glass. The shielding needed for beta particles include lab coat and face shield. Example of beta particle is strontium-90. It is used in eye cancer treatment. What should the nurse do? Cover all skin. Check for skin burns. Gamma radiations. Gamma radiation penetrates lead or even concrete. The shield needed are lead apron and also distance. Technetium-99m is an example. It is usually used in scans. Cobalt-60 is also an example, usually involved in cobalt-60 therapy, we must ensure as a nurse to obey the ALARA principle. What does the ALARA principle say? A as, L low, A as, R reasonably, A achievable. So ALARA principle says all radiations must be as low as reasonably achievable. This ensures that you take note of the type of exposure, the time you give to the exposure, the distance to the exposure, and the shield in which the nurse practice with regards to exposure of radioactive elements. Let's see this. There was a spill of iodine 131, which is an isotope of iodine. It is a beta or gamma emitter during thyroid uptake test. What should the nurse do? 1. Evacuate. 2. Cover spill with plastic. 3. Call radiation safety officer. 4. Monitor staff with Geiger counter. A staff got a spill of iodine 131. This is what the nurse must do. Let's look at this calculation, very important for NCLEX examination. A patient received iodine 131, which has a half-life of 8 days. When is the radiation less than 5% of its original size? What's the answer? 5 half-life is equals to 40 days. When a patient who has undergone thyroid scan using this iodine 131, it usually goes off the body through sweating, through saliva, through urine. So there is, instead of 40 days isolation, the isolation period should be 3 to 5 days until these secretions such as saliva and nasal secretions are safe. It should be tested for iodine 131. However, let's look at this calculation. How did we arrive at this calculation? Study it very well. Now, for every half-life, we have said that the particle divides by half of the size. So if the half-life was initially 100%, let's see this calculation. If the original activity remaining was initially 100%, when the half-life was 0, it will be 100% because it has not divided to half of the size. So at the first half-life, it will divide to 50% because that's half of 100. At the second half-life, divide by 25, which is half of 50. By the third half-life, it goes to 12.5%, which is half of 25. At the fourth half-life, it gets to 6.25%, which is half of 12.5. At the fifth half-life division, it will divide 6.25 into half, which will give us 3.125. Now go back to the question. It says, when is the radiation less than 5% of its original? The radiation became less than 5 at the fifth half-life. So it was at the fifth half-life that we got 3.125%. So we calculate when it falls below 5%. After 5 half-life, only about 3.125, which is less than 5% of the original radiation, remain. So how do we calculate it? One half-life is equal to 8 days. So 8 days times 5 will give us 40 days. So after 40 days, the radioactive element of iodine 131 is less than 5 of its original dose after 40 days. So basically, patients who are exposed to this can be kept in the isolation for just 5 days, because after about 5 days, the amount of iodine 131 should be insignificant, less than 5%, so the patient can be allowed to leave. Objective 4, we want to discuss nuclear structure and radioactive decay. Half-life of an element determines the isolation time for patients. It also determines waste disposal and scan timing. We'll talk about nuclear structure and radioactive decay. If you take a look at the atomic structure overview, you find that an atom is made of, as you can see, an atom is made up of proton, neutron, and of course electrons. So basically, when we talk about nuclear structure, we talk about the composition of an atom. So basically, nuclear structure of radioactive element constitutes of protons, which is positive, neutron, which is neutral, and surrounded by electrons, which are negative. Mass number is equal to the number of protons and plus neutrons, while atomic number is made up of the numbers of protons. So mass number is equal to proton plus neutron, atomic number is equal to protons. Take note of this example. An example is a radioactive element called X. The mass number is 4 and the atomic number is 2. You will be given examples in the exam hall or maybe in class. Ensure that you take note of their calculation. For the number at the top is the mass number. It constitutes the number of protons and the number of neutrons. So basically, if we were given this example and we were asked to look for the number of neutrons, we already know that any number found at this bottom part is the atomic number. The atomic number is 2, which is the number of protons. So here is 2. 2 plus another 2 here will give us 4. So the number of neutrons is 2. I believe it's clear. So let's move on. We look at radioactive decay. Radioactive decay is simply the process by which unstable nuclei lose energy by emitting radiation. Types of radiation are alpha decay, beta decay, and gamma decay emissions. Half-life. Half-life is the time taken for half of a radioactive sample to decay. Relevance. The relevance of radioactive decay explains why certain medical isotopes lose activity over time. Half-life is equal to the time of radioactivity cut to half. Example, technetium-99m has half-life of 6 hours. This means that it must be used within 1 day. So it implies that a hospital waste will decay in 48 hours. So if you put it in the yellow trash, you should wait 48 hours before discarding the waste. Also, iodine-131 has a half-life of 8 days. So patients should be isolated at least 3 to 5 days. Waste should be stored 90 days before disposal. Objective 5. Explain radioisotopes, nuclear reaction, and nuclear energy. For example, nuclear fusion and nuclear fission. Radioisotopes, nuclear reaction, and nuclear energy. What are radioisotopes? Radioisotopes are isotopes with unstable nuclei that emit radiation. Medical uses, for instance, iodine-131 is used in thyroid imaging and treatment, technetium-99m is used in diagnostic scans, and cobalt-60 is used in cancer radiotherapy. Nuclear reactions, nuclear fission, and nuclear fusion. What is nuclear fission? IS, not US. So fission is the splitting of heavy nuclei to release energy. Example is uranium. Uranium can split into several isotopes. Fusion is the combination of light nuclei to form heavier ones and release massive energy. Example is the activity of nuclear fusion taking place in the sun. So basically, let's take note of the definitions of nuclear fission and nuclear fusion. Nuclear energy. Nuclear energy is the energy released during a fission or fusion. It is the energy used in power plants, in medical applications, and also in research. This energy is used in power plants, is used in medical applications, and also used in most research. Radioisotopes, nuclear reactions, nuclear energy as a form of summary. We look at the concept of radioisotopes. Nursing application, it is applied in the use of technetium-99m used in the workhouse of nuclear medicine. It is the workhorse of nuclear medicine. In fact, it constitutes 80% of most scans in radiotherapy in the radiotherapy world. What should the nurse do? Ensure to verify patients' allergy history, although it is rare, but some patients are allergic to radioisotopes. Ensure to also hydrate patients after the scan to flush tracers. Ensure that patient is being rehydrated after scan. Nuclear reaction. Nuclear reaction, for instance, fission, like we said, is the splitting of atoms. For instance, technetium-99m is produced by the process of fission. Nuclear reaction may not have direct action, but we must know the supply chain delays if reactor shuts down. Nuclear energy. Nuclear energy is found in fusion, although it is not used in the clinical space. It is used in astrology, in stars and sun. So nurses may not have any direct use with nuclear energy. Let's focus on fission-based isotopes such as technetium-99m and iodine 131, which is common in the hospital. Let's move to objective 6, health hazards from radioactive substances. This to enable us to recognize radiation exposure symptoms, look at early symptom recognition that saves life in case of a spill or an accident in the radiotherapy ward. Hazards from radioactive substances. Number 1, they are hazards that have short-term, which are acute effects, long-term, which are chronic effects, and of course some occupational hazards. So let's take note of this. Short-term health hazards to radioactivity include skin burn, nausea, vomiting, radiation and radiation sickness. 2, long-term effects include cancer, genetic mutation, infertility, and cataract. 3, occupational hazard. Nurses in radiology and oncology wards are at high risk if not protected. Summary: we want to look at the dose of some radioactive elements. We'll look at the symptoms and nursing priority. Basically, with regards to exposure to radioactive elements, there are some doses that will become excessive to handle by the human body. So let's begin. About 1 to 2 Soviet doses of exposure will lead to nausea, vomiting, and it constitutes about 3 to 6 hours of exposure. Nursing priority. Nurses must treat as emergency when it has led to nausea and vomiting. There is need to also collect urine and feces samples for bioassay. About 2 to 6 Soviet doses will lead to diarrhea and fever about 1 to 2 hours. There is need to isolate the patient. There is need for blood transfusion for bone marrow damage. Soviet dose of greater than 6 will lead to symptoms such as neurological collapse in less than an hour. Nursing priority. This is a serious exposure and there is need for palliative care only because it is 100% fatal. Objective number 7. We want to look at some precautionary measures in the healthcare settings. This will help us to implement safety protocols in the healthcare system. Some precautionary measures in healthcare involve 1. Use of lead aprons, shield, and barriers. 2. Ensure you consider the time, the distance, and the shielding principle. This is to minimize the time, maximize the distance, and use shielding. Number 3. There must be proper disposal of radioactive waste. As you can see, wastes are disposed properly. They must be disposed properly. Waste bin have several color indications where chemical substances should be placed in, where radioactive substances should be discarded. 5. There must be strict adherence to hospital radiation safety protocols. So we'll look at some hazards, precautions, and nursing action. There are biochemical substances which are hazardous. Precautions. Biochemical substances are found in chemotherapy drugs. Example is your cyclophosphamide. Nursing action. Ensure to wear chemo-rated gloves or gown, and there should be no eating in the med room. Radioactive substances are hazard. Example is found in technetium-99m and also iodine 131 when they are spilled. Nurses must take note of the ALARA principle. Hazards can also be found in waste disposal, such as contaminated syringes and gloves. Take note that red radioactive bin must be used, not irregular trash. There could be pregnancy risk hazard in exposure. The precautions that we must note is that there is fetal radiation sensitivity with the pregnant woman. So pregnant staffs must avoid nuclear medication areas and wear fetal dosimeters. Let's answer this. A technetium-99m vial shatters in the nuclear medicine lab. Staff report nausea. List 4 priority action using the ALARA principle and general hazard knowledge. Number 1, evacuate the room. That's time. Cover the spill with plastic sheets. That's shielding. Call radiation safety officer. That's expertise. Monitor staff with Geiger counter. That is assessment. As we round off, I want you to take note of the differences between mass number, and atomic number. These are areas that are very relevant for your examination. I also want you to take note of the types of radiation and their properties. For your clinicals, you must ensure that you know the hazards of radiative elements so that you are not exposed to radiations. I want to thank you for listening to this video. With this, we have come to the end of NUS 111, which ends at module 7. Ensure to subscribe to our channel and tell us what you think about our videos. From me, it is bye-bye.